Hi everyone, I am Dr. Nisha Vishnu, a practicing radiation oncologist. If your treating oncology team has referred you to a radiation oncologist and you have been advised for radiotherapy and you are kind of confused as to what to expect, you have come to the right place. Let me take you through the steps that you may go through during your radiation therapy treatment. That is, we'll be talking about the complete workflow in the external beam radiation therapy. Let me remind you that this video is in no way superseding the instructions from your treating doctor. There may be variations as every individual situation is different and need a tailored approach. Hence, this video should be used as a cross guidance for an idea as to what to expect before and during your stint with radiotherapy. Step 1 is the OPD consult with your radiation oncologist. On your first visit with your radiation oncologist, you will be asked in detail about your present condition. We call it history taking. We will be interested in everything pertaining to your health, including any adjoining health condition like diabetes or high blood pressure, etc. And what medications are you on at present? We would even want to know about your family history, your occupation, your habits, etc. All these questions are put across to understand in detail about your disease, which would help us to plan and execute your treatment in a better way. We would also go through your entire treatment file to look into, the test or the treatment that has already been done. We may ask you to perform a few more tests which would help us to reach a final diagnosis. In our institute, your case would have already been discussed in a tumor board, or if not, will be discussed. A tumor board is a meeting wherein the entire team of oncologists, including the surgical, the radiation and medical oncologist, along with the doctors from oncopathology, nuclear medicine and radiology would sit together and discuss what is the best course of action for you. Step 2, once the final diagnosis has been made, we will form an action plan which includes the dose of the radiation that is needed, the number of fractions or sittings, and the technique that would be apt or most apt in your situations, etc. In our setup, at this point, we give a detailed explanation to the patient and family as to why we recommend a particular treatment, what would be the expected benefits and probable side effects, existing alternatives, if any, and how the treatment would be executed. We would also answer all your questions and doubts at this point of time. A written consent will be taken if you agree to go ahead with the treatment. After this, you will be directed to the insurance or the billing desk. Billings are usually done according to the techniques that is used and is fixed as a package for the entire treatment in most cases and is usually covered by most of the insurance programs. Step 3, this step is known as simulation. Why simulation? Radiotherapy is a treatment that is based on focusing high energy X-rays into the areas of your body harboring cancer while minimizing the doses to the adjacent normal areas as much as possible using machines known as linear accelerators. Now the machine does not know you as a patient. It only knows the coordinates that is fed into it. By coordinates, I mean if you're blindfolded and need to locate a chair in a room, how could your friend help to locate it? He or she could direct you to move so many steps in the x-axis, then so many steps in y-axis until you reach the chair. Similarly, the machine is instructed to send or not to send x-rays towards a particular point with reference to a point called as isocenter. Although this is too much of an oversimplified version, I hope this gives you a vague idea. Now, where do we mark these areas? Or how does the machine recognize your body? The information of your body is fed into the machine by the means of a CT scan. Before the CT scan, there will be some form of mold that will be made for you. This mold is a way to immobilize you so that on all your treatment days, you are exactly in the same position. Mold could be a thermoplastic mask that is covering whichever areas we are treating, or it could be a bag-like thing that we call as backlog, which would conform to your body contour, or it could be anything that would put you in a particular position that is exactly reproducible throughout the treatment. With the mold on, we take the CT scan. Molding takes around 20 minutes and scanning around 10. Sometimes on the planning day, we might ask you to come empty stomach or with 3 to 4 hours of fasting, or advise you an enema, or we might fill your bladder to a particular level, or we might add some breathing technique depending upon which area or what type of cancer we are treating. After the CT scan, we would mostly send you home after collecting the entire treatment file, scan CDs, etc. Next step is planning, and I'll be dealing with it in my next video. Thank you.